You are watching McFarlane Report here on today's health program, and today we're talking about serious conditions that affect the colon with Dr. Karen McFarlane. Dr. McFarlane, in this segment we're going to talk a little bit more about colitis. Can you explain what colitis is?
Colitis is, number one, is a very common condition, and what it involves is actually what we call it inflammation of the colon. And there are many reasons why people have inflammation of the colon.
And so that really can happen at any age, colitis, is that?
Absolutely. It really comes down to what's the cause of it. So for example, you have viral, we also call it infectious. It can be attributed to medications. So for someone who had a recent cold or was given an antibiotic by chance, they can develop what we call C. diff colitis. There are others where you have a lack of blood flow to your colon. It's called ischemic colitis, which can be fairly dangerous. So those are just to name a few. And last but not least, the most common one is diverticulitis.
So, so then some colitis can be temporary then, if it's like
Absolutely.
a cause from a virus.
With viral, sometimes we call it the stomach flu. You have a quick rash of diarrhea. Usually it responds in itself or recedes within about 2 or 3 days on its own. Just stay well hydrated.
So what kind of symptoms would you look for if you were suspecting colitis?
Usually it's a crampy abdominal pain. Of course, your change in bowel habits is number one. So with colitis, you tend to have more of a diarrhea situation. Some people actually notice blood in their stools or where there's more mucus than they would expect. But the trick is there is usually a crampy abdominal pain component too.
And how is colitis diagnosed?
First of all, you got to see your doctor. So it's a physical exam diagnosis. We usually ask certain questions. Do you have change in your bowels? Are you noticing blood in your stools? How often is your bowel movement? So some people have told me, oh, I have diarrhea, and it's just one situation versus 5 or 6 events in a day. Okay, we can then step it up by getting what's called a colonoscopy for a few, where you take small pinpoint biopsies of the colon, and the others also include doing something called a barium enema, which is actually what we call a radiological study, versus actually a CT scan, which tends to be more common.
So if someone has colitis and they don't seek treatment, are there complications from not having it treated?
Absolutely, and it really depends on which type that we're distinguishing. So for example, the most common ones that we see includes diverticulitis. That in itself could be Russian roulette with your life, because if you rupture a pocket of your colon, which is the diverticulitis pocket, that can quickly accelerate into an abscess versus what we call creating a perforation in your colon where you need surgical emergency for.
So when should people see their doctor?
Well, if usually the event is something that happens very suddenly, let's say, I was feeling fine and I'm having crampy belly diarrhea, it goes on for more than a day or two, or your pain is really excruciating, please don't wait, call your doctor.
And so really their family doctor or their primary care physician is where they would start?
Correct. Of course, if things are progressed to fevers and it's uncontrollable pain, then you really have to escalate that to being seen on an emergency basis.
And so you're a general surgeon, so where do you get involved? When the doctor orders the colonoscopy, or?
Yes, so that too. We certainly don't want this to be a last-minute event where, it's the extent of rupturing your colon. That's a surgical emergency. But generally speaking, we get involved when there's a scope that's required in itself.
Okay. So what would be the treatment options for someone that has colitis?
Usually it is finding what caused it. So it's a viral form. You do not need antibiotics. I really have to stress, you do not need antibiotics for what we call stomach flu. It's usually, we call it antiviral, and keeping well hydrated. Okay, what comes in, comes out. They call it a rice or brat diet, bread, rice, applesauce, or tea, something that's what we call low residue. So liquids, have more of it. Okay. Avoid dehydration.
So this is a crazy question, but being from Michigan, what about Vernors? Because I always thought when you had a stomach ache, you resort right to Vernors. Do you know anything about
Vernors,
that?
I do understand. Part of what the benefit of Vernors is called the element of ginger. Okay. And actually ginger is excellent because it's actually used as an anti-nausea medication.
Very good. Well, I've always enjoyed it. So that's the first thing that I reach for when I have a stomach problem. So I wanted to talk a little bit more about the colonoscopy.
Sure.
Because we know that's a screening to detect colon cancers. But the guidelines have kind of changed about when they're ordered, or can you explain?
So The colonoscopy is really dependent on what we call risk factors for each individual. Normal risk factors include no family history of colon cancer, no family history of polyps, and quite to add, no family history of what we call inflammatory bowel disease from our previous segment. In that case, then you start roughly around the age of 50. When you do have more things in your family, colon cancer or polyps, then we become more aggressive about that.
I know there's a lot of different options when it comes to some of the screenings. So there's some different kinds of tests that aren't quite as invasive as the colonoscopy.
This is true. We often find that when we see our patients in the office, the last thing they want to hear is, hey, it's your birthday, you need a colonoscopy at the age of 50. Part of that is oh my gosh, I have to use the bathroom and sit near a toilet. We get that. Others were very afraid of drinking a gallon. I mean, a gallon is something we call it go lightly, which is a very, very poor choice because you're going plenty.
Right.
You're not going lightly. So with that being the case, usually it is the diarrhea portion that people do not like and drinking this large volume of fluid, but things have changed now.
And so what are some of the other options then for patients besides?
So for one is, if number one, it really comes down to what your insurance allows us to do. So if it is a routine colonoscopy, then your prep has changed. No longer do you have to do a whole gallon of go lightly. You have other options where Propopic and all these different things where your bowel cleanse is no bigger than a coffee cup, if you will. So that helps. Okay, if your insurance does allow you to have other options, there are new options called Cologuard. Cologuard is, you avoid the prep, you avoid having the scope, okay, and truly if there are a normal result, then you get the colonoscopy.
Because it's probably really the best. I mean, the most diagnostic is the colonoscopy, but the most invasive.
Because you have the option to treat, and that's the difference. With your colonoscopy, we see the polyp, we can remove it. The other things, you have things called virtual colonoscopy. The only benefit it does is to avoid having the actual colonoscope, but if you have polyps, you will still have to go to the next step, which is the colonoscopy.
So that would be like an x-ray type or a CAT scan maybe of the virtual, is that?
The virtual colonoscopy, we have to be very careful because we have to find reasons why you cannot have it. You can ask for it, but again, we're also limited to what your insurance company would allow us to do.
Because the insurance companies must see the colonoscopy maybe as the gold standard, or
usually the gold standard, unless there's risk that prohibits you from having a colonoscopy.
Very good. Well, this has been really great information, a lot for our audience to take in. So we do need to take another break, so we'll be back in just a few minutes.
Thank you.